Hi, I'm Paul W. Smith, along with my retirement planner and friend Chris Alberta from Principium. 'Tis the season. Millions of our Michigan seniors are faced with a whole bunch of decisions during this Medicare election period. And to make matters worse, there are headlines galore about scams and new restrictions and all kinds of stuff. They make it so difficult when they don't need to. So, Chris, I'm turning to you as my retirement planner, as a friend, to start to, in this short conversation, start to make some sense of this. Where do we even start unraveling this mess, Chris?
Okay, let's go back to the beginning because most folks, Paul, can't possibly unpack what you and I do in 5 minutes on the radio. Medicare in its prime form is A and B, two components. A is things, B is people. So let's call A hospital and B doctors. We all get Medicare because we paid taxes. You get Part A because you paid taxes for 40 quarters. Doesn't matter if you were Warren Buffett or Paul W. Smith or the guy at the factory. A is A is A. Okay. B, we're entitled to buy B for about $165 a month in 23. And all that really does is cover 80% of everything that Medicare approves. So in its rudimentary form, A is things, B is people, C and D, the other components we'll get to. But most people, Paul, unless they have employer coverage and they're still working perhaps, or they're on Medicaid because of low income, what they're trying to do is figure out how can they protect themselves against the 20% that Medicare leaves behind. A 20% of the visit to the podiatrist because you got a funky toe is a lot different than 20% of a quadruple bypass, right? So historically, almost everybody would go out and buy what's called a Medicare supplement. Sometimes they would call that Medigap, right? And Medigap for 30, 40 years essentially existed just to pay that 20% that was left behind. It's pretty easy in terms of the concept. But now, with the invention, really the creation of Medicare Advantage, everyone has this big fork in the road. Okay, so if I'm turning 65 and I have my Medicare Part A and I choose to turn my Part B on, I have to make that choice in the first place. And Part A and B alone, not really going to do it. So let's simplify it for a minute. If I go and buy a Medicare supplement, as many people still do, tens of millions of people in the US, what that's doing for me is I'm paying one premium to that insurance carrier. Now, unless I come into that carrier during the open enrollment period when I turn 65 or my Part B starts, they're going to ask me medical questions. So I have to be healthy enough. It's not Obamacare. I do have to answer health questions and be approved. But as long as I pay my premium, here's the real upshot to Medicare supplements, the traditional ones. I can go anywhere. I can go to any doctor, any hospital in the United States that takes Medicare. They have to take my supplement. Okay. And what's more, every supplement from every carrier is identical to each other.
Really?
Across the board. From the biggest names you've heard of, the national advertising ones, to the little boutique ones, as we would call them, the benefits are 100% the same. The only difference is the price that you pay each month. It's based oftentimes on zip code, age, gender, so on and so forth. Also, how they change rates over the years, the methodology by which they do that makes a big difference, and the history of the carrier in terms of rate increases and jostling around with health questions and things. So for a lot of those people, I would call them knowers. They're old school. There's no school like the old school. They want to know, when I go off into my golden years, is everything going to be covered? Can I go anywhere I'd like, right? Am I going to have hiccups and have to change things each year? There's still a contingent of people that want that kind of surety, okay? On the other hand, let's take the other fork in the road. The country has 330 million people in it. And back in the early 2000s, when W. Bush was in office, they went through what's called the Modernization Act of Medicare, and they introduced Part C of Medicare. That's the Medicare Advantage. Now, here's what gets really confusing, is that Medicare Advantage is, in reality, an alternative to traditional Medicare. So those folks on Medicare Advantage, they're still paying their Part B premiums, but they're not getting their health care provided by the federal government anymore. They're relying on a private company to be their Medicare, so to speak. It's very much like I teased you in the past. It's the difference between going to the United States Postal Service with your package, government service, or going to a FedEx or a UPS. It's a private version of a similar service. Is that fair?
Yeah.
Yeah. So what's fascinating here is that as the Advantage programs have really come in to fruition, so to speak, they're out of their infancy, which was the early 2005, 6, 7, through their adolescence. Now they've become enormously popular. And with all of those choices and all of those moving parts, that's garnered a lot of extra attention by regulators. It certainly has confused the marketplace, right? There's way too many options, in my opinion.
Mm-hmm.
But at its core, here's where they differ wildly. On one hand, if you're a knower, an old school mentality, you probably want that supplement. And you say, I don't care if it's $150 a month or $250 a month, I'm going to pay that premium and never get a bill. And that's pretty fair. Okay. However, there's a great many people over the years who have said, why am I just paying this supplement every month for years and years? In many cases, for two people in a household, I'm prepaying tens of thousands of dollars in premiums for services I might never get. Now, Advantage's focus is a little bit different. Many of them, as you've seen in the paper, they're called zero premium programs. So I'm not paying anything to the insurance company. They're getting awarded their money to cover me from the feds, right? That company's now taken me off the federal government's hands, so to speak. But I'm going to pay copays for what I use, right? Maybe for this prescription drug, maybe for this surgery, maybe for this MRI, but there will be a cap on how much I can spend total. So there's a stop limit there in force, okay? So both of those avenues are ones that have a tremendous amount of merit. And I contend oftentimes that there's no one way that's really wrong. Both of the different kinds of programs will work effectively, but the real problem that we're facing nowadays is how can people make sense out of all the choices, right? You've seen the headlines about all the scams, you know. What's the one you have in your hand there? Beware of Medicare scams.
Prepare for Medicare scams.
Right. So see, I would say to you that this is an interesting environment because on one hand, it's good that the media is bringing this to light, but it's also misleading because the carriers, the programs themselves are not really what the scam is. It's all of the hundreds of telephonic sales outfits all over the country that in many cases are misleading people or they're not disclosing things properly. And so folks end up on these plans and then they complain. They say, geez, they didn't tell me that. The premiums have gone up. I didn't know my doctors weren't in the network. And CMS, who governs all of this for the federal government, they're tired of it. So they've now upped the regulatory benchmark, so to speak, in a fashion that they should.
I want to go back. Chris Alberta with us from Principium. He's our retirement planner and very helpful to Kim and I think could be very helpful to you. And that's why we're together here to go through some of this. Obviously, it would take a lot more time and you should spend time with Chris or your financial planner or whoever you would choose. You mentioned fork in the road. It seems to me that means there's a right turn and a wrong turn. Is that true?
I think there's a right turn and there's a left turn, right? There is certainly a way by which potential for saving money on Medicare Advantage and also picking up some of the preventative benefits, dental, vision, gym membership, the inclusion, for example, of a Part D plan that covers prescriptions. Those are nice benefits. And, now post 08, most people are used to having deductibles and copays. It's not like the old days where the expectation was I go to the doctor, I never get a bill. I go to the store for my prescription, it's $2, right? So I think you can make the case that a great many people will save a tremendous amount being on a Medicare Advantage program. But you're always going to be able to point to the cases where because of an illness or injury, that client, that member would be better off on a traditional Medicare supplement. You do quite a bit of traveling for work and for life. If you were my client and you said, Chris, I'm going to be bouncing around the country, a good 6 or 8 times a year, and I've been battling a couple health things that have put fear in me, I would probably encourage you to stick with a traditional supplement. We don't want the confines of a network that you have to adhere to. We might not like the variability and surprises in the cost structure. But as the advantages get more popular, it's certainly, they are expanding their coverage into out-of-network things, and certainly some are better than others, and that's where an advisor is a necessity rather than a luxury, I think.
It's you don't want to find out that stuff is not covered at the time of the need. You just don't want it. So there's clearly, not to sound ridiculous, there's certainly an advantage to Medicare Advantage.
There can be some advantages, certainly. There is also additional liabilities financially that at least you should be aware of, right? If the most I can spend on a Medicare Advantage is, let's say, $5,000 or $6,000 in a calendar year, for many of us, that's digestible. That's a risk worth taking to save all those premium dollars. Part of the reason that Medicare Advantage had a very, very hard run up through its adolescence was because anytime you offer something at a very low or no premium environment, you often bring in people by default who are looking so hard to save money. And many of those people are struggling economically, and many of them struggling physically with illness. So the claims got outrageous. And then, of course, people can't pay the copays, and the problems start that way. There is not a wrong turn, though.
No, there isn't. That's why we need someone like you to explain to us. Here's what happens on this left turn.
Sure.
Here's what happens on this right turn. And it also sounds to me like that, because I frankly haven't gone here yet, but it always sounded like me, and I'm listening to the commercials, the other commercials, not the ones I do for you, which I'm happy to do, but I do hear these people say, in fact, I'm probably getting things in the mail that are right now that are saying, that you can get this for no cost to you,
Sure.
for no pay plan, whatever. And so they are being honest in that regard. It is no pay from us, to a degree.
To a degree. And I think that if nothing else, our listeners need to understand that most of the things they're seeing on television in terms of advertisements, and certainly everything, if they go on and they Google how to find a Medicare plan in my area, Medicare Advantage, Medicare Supplement, the lion's share, if not nearly all, of what they will see organically, 2, 3, 4 pages in, are all outfits that are either selling your information as a lead to an agent somewhere telephonically, or to a sales house that's out of state. So what I would like to see, and I think that we can make some headway in this together, is a bit of a renaissance, right? Where we need people to be willing to reach out to a real Medicare advisor or Medicare agent in their area. Okay, look at them face to face, sit at the kitchen table if need be, because a good advisor knows the history of all these products in our great state of Michigan. They know who has trouble paying claims. They know who has a bad history of rate increases. They certainly know where the networks are faultier. Okay, so most of what we see in terms of the confusion and the scams are a byproduct of the sales machine being more important than the serving machine. And we can change that.
Well, what I've seen in visiting you at Principium, frankly, Chris, is that it appears that you're have shown me some options that I've been unlikely to see anywhere else.
That's true. We have a big menu, as we all do. Part of the problem in the financial services industry between you and I've shared this with you, is that there's a great amount of commission bias towards not only the popular names, right? As I always remind people, easy to tell is easy to sell, right? This company advertises 100 times a day. They've been around for 50 years and they pay a big old commission. It's a pretty easy case to get someone involved in.
Right.
But oftentimes your needs, your health, your budget, your capabilities in terms of travel will dictate what you should be on. And that's our job.
Well, and I have to tell you from my own personal experience, you do it very, very well. There's obviously merit to all the different options. The average person, I'm like the average person, I can't choose without guidance, without help, which is why I have Chris Alberta as my retirement planner. So how does a good insurance agent come to a recommendation without the very human influence of knowing where your best commission or payoff will be? I mean, that's asking a lot of a human being.
It is. And that's why I think the fiduciary standard has really roared back. And some of that is marketing, but very much of it is
Explain briefly. I don't mean to derail you.
Sure.
Explain what it means when you are a fiduciary for someone. It's important.
Okay. Well, acting as a fiduciary in any capacity is making sure that you are putting the needs and best interest of Paul ahead of Chris. right? And that is a hard thing to quantify in many of these circles. Certainly in the investment world, it's been very hard to quantify.
Right.
There's heartbreaks with stock market. No one knows what the stock market is going to do tomorrow, right? But in the Medicare space, healthcare is the second largest expense for a retiree. From 65, let's call it, to 90 to 92 years old when all these tables are running. So I believe, Paul, it's imperative that people have a little bit of a restored faith in the insurance agents themselves, especially those who claim correctly to be experts in Medicare. That agent should be sitting with Paul and Kim and talking to you about budget, health, what prescriptions you take, what territories or parts of the country you're going to spend most of your time in, and showing you both forks in the road, so to speak, both options, and helping you decide, because really it is your healthcare and you're the one that's rolling the dice with copays and deductibles and networks. Our job should be to be educators and not salespeople.
Well, and I know this from being in the office for other reasons and for my investment portfolio overall. You do have an excellent Principium Medicare team.
Very good.
It's not your biggest money maker. It's more of a service you offer to your regular clients.
It's a passion project, and that's not to say that it's not profitable. There's a litany of very good Medicare people in Michigan who make a tremendous living specializing in Medicare. But most of the reasons that they have been able to be successful in it is because they are truth tellers and educators first. I have at least seen the trend that salespeople in Medicare have a pretty short run. You can convince someone to jump on your plan, but when it turns out to be, kind of a sour egg, they tend to look elsewhere.
Really? All right. The time has zipped by. We're almost out of time. So tell me, although this is all very helpful and great, give me us the three biggest mistakes people make when choosing coverage and how to avoid those mistakes.
Well, the first one I think is easy, and that would be putting too much emphasis on a popular name. Names mean very little in an industry that's been regulated and standardized by the federal government. So I'm reticent to say names here in the interview because of the regulators, but I would say that some of the biggest names we associate with the protection and care of seniors are not necessarily the best products, certainly in Michigan. So don't put name ahead of long-term value and track record.
All right.
Secondly, price and cost are two different things.
What do you mean?
Well, I could certainly jump into a Medicare supplement plan that offered an introductory rate that's $20 a month less than another one. But the long-term cost of potentially being stuck on that plan for years and then absorbing all of their rate increases, the cost is far more important than the initial price. We get sucked in because of the best value initially, but the consequences long-term of a bad choice there can be pretty crippling. And third, I would say to trust your gut. I think that in the retirement space, the business in general, far too many clients are now online, they're Googling things, they're trying to do their own research, and what they're really reading is opinion-laden pieces from PR machines that are trashing this company and building up another because that's their job. Right? When you sit with a financial advisor or an insurance agent, if you feel as though your questions are getting answers that are evasive or kind of nimble, you'll know that, right? You should not like every answer you get, because if we're being honest on our side of the desk, some of the answers are no fun to hear. There's not one single product, whether it's an investment or an annuity or a life insurance or a Medicare policy, that is all pros and no cons. It's our job to make that list together and see where that fork takes us.
Excellent. That's excellent advice in a very short period of time. One last thought, comment, word.
I think that it's time that we really do our research and get back to face-to-face old school. Let us earn your business by proving that we can do things honestly and take the time to do it, not be rushed, have no pressure, and then we're on the right road. It's a short road to get back there, but it's overdue.
And an important road for sure. Chris Alberta of Principium, my retirement planner and investment advisor. I think you'll like him. I hope you learned a little something here today with this short conversation. There is much more to learn, to take advantage of, and you need to do this. You can't do it, I'm afraid, on your own. It's too complicated. You and I have other jobs. We do other things. But if we give the Principium Medicare team a call, or Chris Alberta specifically, at 888-800-8949, that's 888-800-8949, I think you will be on the right road. And Chris, I appreciate you coming in and discussing this with us.
Thanks for having me, Paul. We appreciate you.
Thanks for being here with us on WJR.